There is something important I want to talk about today, especially if you are over 65, care for an older parent, or regularly eat salads, fresh herbs, berries, and other raw produce. Most of us think of these foods as healthy choices, and in general, they are. But under certain conditions, fresh produce can carry a microscopic parasite called Cyclospora. When that happens, what begins as an ordinary stomach problem can become a serious health concern, particularly for an older adult. I do not want this conversation to make you afraid of vegetables or fruit. That is not the purpose. I want to help you recognize a pattern that is often overlooked, understand when diarrhea is no longer something to simply wait out, and know what steps can protect you or someone you love from dehydration, weakness, and hospitalization. Cyclospora cayetanensis is a microscopic parasite that infects the small intestine. People usually become infected after consuming contaminated food or water. Over the years, outbreaks have been associated with foods such as leafy greens, lettuce, cilantro, basil, raspberries, blackberries, snow peas, snap peas, and other produce that is often eaten raw. One of the difficult things about Cyclospora is that contaminated food usually looks completely normal. The lettuce may appear fresh, the herbs may smell perfectly fine, the berries may be firm and brightly colored. There is no unusual taste or odor that warns you a parasite is present. Another unusual feature is that Cyclospora does not normally spread directly from one person to another in the same way that norovirus does. When the parasite leaves an infected person's body, it needs time in the environment before it becomes capable of infecting someone else. That means you are unlikely to catch Cyclospora simply by sitting next to an infected family member, hugging them, or caring for them in the same home. Good hand washing and bathroom hygiene are still essential, but there is no reason to withdraw affection or isolate someone out of fear. The infection is mainly acquired through contaminated food or water. The most common symptom is watery diarrhea. It can be frequent, sudden, and difficult to control. Some people also develop abdominal cramping, bloating, excessive gas, nausea, reduced appetite, weight loss, headache, body aches, and a level of fatigue that can feel far more intense than expected from a simple stomach illness. A mild fever may occur, but many people never develop a fever at all. The timing of the illness is one of the clues that makes Cyclospora different from many common forms of food poisoning. Some bacterial foodborne illnesses begin within a few hours after a meal. Cyclospora usually takes longer. Symptoms often begin about a week after a person consumes contaminated food, although they may appear sooner or considerably later. Because of this delay, people often blame the wrong meal. You may become ill today because of something you ate last week. By the time the diarrhea begins, you may no longer remember the salad you ordered at a restaurant, the fresh herbs added to a meal, or the fruit you ate several days earlier. Cyclospora also has a pattern that can be very frustrating. The symptoms may improve for a short time, making you believe the illness is ending. Then the diarrhea returns. A person may feel better for a day or two and then suddenly become sick again. This cycle of improvement followed by relapse can continue if the infection is not properly identified and treated. That does not mean every episode of recurring diarrhea is caused by Cyclospora. Many different infections, medications, and digestive conditions can produce similar symptoms. But when watery diarrhea continues for several days, disappears and returns, or causes increasing weakness, it should not be dismissed. This is especially important for adults over 65. In older adults, the greatest immediate danger is often not the parasite itself. It is the loss of water and electrolytes caused by prolonged diarrhea. As we age, the sensation of thirst can become less reliable. An older person may already be dehydrated without feeling particularly thirsty. Some people also intentionally drink less because they are concerned about frequent urination, bladder problems, or waking up repeatedly during the night. Many older adults are also taking medications that affect fluid balance, blood pressure, kidney function, sodium, or potassium. These may include diuretics, blood pressure medicines, diabetes medications, anticoagulants, and other prescriptions. When diarrhea continues, the body can lose fluid faster than it is replaced. Blood pressure may fall. Kidney function may become strained. Sodium and potassium levels can shift. The person may become dizzy, confused, weak, or unsteady. This is where a digestive infection can lead to consequences that families do not always anticipate. An older person loses fluid because of diarrhea. The fluid loss causes weakness or dizziness. The person stands up to walk to the bathroom, loses balance, and falls. That fall may lead to a broken hip, a hospital stay, rehabilitation, and sometimes a permanent loss of independence. This is not an attempt to frighten you. It is a realistic chain of events that can often be prevented when the warning signs are recognized early. Pay close attention if an older adult develops a very dry mouth, unusually dark urine, or begins urinating much less frequently than normal. Watch for dizziness when standing, increasing weakness, a rapid heartbeat, confusion, unusual sleepiness, or difficulty keeping fluids down. These symptoms suggest that the body may not be replacing what it is losing. Persistent watery diarrhea lasting more than a couple of days deserves medical attention, especially in someone who is older, frail, immunocompromised, or living with kidney disease, heart disease, diabetes, cancer, or another serious medical condition. You should seek help sooner if there is severe weakness, confusion, fainting, very little urine, a rapid heartbeat, high fever, blood in the stool, severe abdominal pain, or an inability to drink without vomiting. Do not assume that diarrhea is harmless simply because it is common. At the same time, it is important not to diagnose yourself. Cyclospora is only one possible cause. A healthcare professional needs to consider the full picture, identify the cause when possible, and evaluate whether dehydration or other complications are developing. One reason Cyclospora can be missed is that routine stool testing does not always include it. Many people believe that when a doctor orders a stool test, the laboratory automatically checks for every parasite and every infection. That is not necessarily true. Testing for Cyclospora may need to be requested specifically. In addition, the parasite may not appear in equal amounts in every stool sample. A person can be infected even when one sample comes back negative. In some cases, a healthcare professional may request more than one sample collected on different days. The laboratory may use specialized microscopy or a molecular stool panel that includes Cyclospora. You do not need to arrive at a clinic demanding a particular procedure. A common specific question is enough. You can say, I have had persistent or recurring watery diarrhea, and I am concerned about possible Cyclospora exposure. Does the stool test you are ordering specifically include Cyclospora? That simple question may help ensure that the correct infection is being considered. When speaking with a healthcare professional, try to provide a clear timeline. Explain when the diarrhea began, how often it is occurring, whether the symptoms improved and returned, and whether you ate raw produce, bagged salad, fresh herbs, berries, or restaurant food during the previous 2 weeks. Mention any recent travel and whether anyone else who ate the same food became ill. These details can be more useful than trying to identify one meal with certainty. When Cyclospora is diagnosed or strongly suspected, the standard treatment is a prescription antibiotic called trimethoprim sulfamethoxyl, often shortened to TM-Semex. This medication has been used for many years and is considered the preferred treatment for cyclosporiasis. However, that does not mean people should obtain it and begin treating themselves. The correct treatment depends on the individual. A healthcare professional needs to consider medication allergies, kidney function, age, other illnesses, and possible interactions with existing prescriptions. Some people are allergic to sulfonamide medications. Others take blood thinners, blood pressure medicines, diuretics, or other drugs that may interact with the treatment or increase the risk of complications. This is why a complete medication list is so important. Do not rely entirely on memory. Bring a written list to the appointment, or take clear photographs of every prescription bottle, over-the-counter medicine, vitamin, and supplement being used. Even products that seem unimportant may affect treatment decisions. Replacing lost fluids is also essential. Small, frequent amounts may be easier to tolerate than drinking a large glass all at once. Oral rehydration solutions can help replace water and electrolytes, but they are not appropriate in exactly the same way for everyone. People with heart failure, kidney disease, or fluid restrictions should ask a healthcare professional how much and what type of fluid is safe for them. Do not make major changes to prescribed medicines on your own because of diarrhea. A clinician may sometimes recommend temporary adjustments, but that decision must be based on the person's condition, laboratory results, blood pressure, kidney function, and current medication use. One subject I need to address directly is the growing market for so-called parasite cleanses. Whenever a parasite is discussed publicly, advertisements begin appearing for herbal mixtures containing ingredients such as wormwood, black walnut, cloves, oregano oil, garlic extracts, berberine, or papaya seeds. Some of these substances contain active compounds, and some have been studied against certain organisms in laboratory or animal research. But laboratory activity is not the same as proving that a product safely cures Cyclospora in a human being. There is no established herbal cleanse that can replace proper medical assessment and evidence-based treatment for cyclosporiasis. The greatest risk is often the delay these products create. Imagine an 80-year-old person who has been experiencing watery diarrhea for a week. Instead of calling a healthcare professional, that person begins taking a cleanse that promises to remove parasites naturally. Another week passes. The diarrhea continues. The person eats less, drinks less, becomes weaker, and begins urinating only once or twice a day. By the time the family recognizes the seriousness of the situation, the person may already have severe dehydration, kidney stress, confusion, or an injury from falling. Using an unproven remedy in place of medical care is not a neutral decision when an older adult is losing fluid every day. Natural products can also cause side effects and interact with prescription medications. A label describing something as natural does not guarantee that it is safe for the liver, kidneys, heart, or blood pressure. Another common question is whether to take an over-the-counter antidiarrheal medicine. The safest general advice is not to use one automatically, especially in an older or medically fragile person. These medicines are not appropriate for every cause of diarrhea, and they may be unsuitable when there is fever, blood in the stool, severe pain, or certain infections. Before using them, speak with a healthcare professional or a pharmacist who understands the person's medical history and medications. The goal is not simply to stop the symptom as quickly as possible. The goal is to identify the cause, prevent dehydration, and choose a safe treatment. Now let us talk about food safety. Washing fruits and vegetables is still important. Rinse produce thoroughly under running water. Gently rub firm fruits and vegetables with clean hands. Remove bruised or damaged areas and wash produce before cutting or peeling it. Do not wash fruits or vegetables with dishwashing liquid, detergent, bleach, or household cleaning products. These chemicals are not intended to be consumed and may create a different health risk. However, washing has limitations. Cyclospora can cling to the surfaces of produce and may remain in small crevices, folds, or tightly clustered leaves. Washing may reduce contamination, but it cannot guarantee that every parasite has been removed. This is particularly difficult with leafy greens, berries, and herbs because their surfaces are uneven and delicate. Understanding this does not mean washing is useless. Washing remains an important step. It simply means that washing cannot transform every contaminated food into a completely safe food. Cooking provides stronger protection because sufficient heat can destroy the parasite. During an active outbreak, or when a specific raw product is under investigation, an older adult at higher risk may choose cooked vegetables more often. This can be a sensible temporary precaution. It does not mean you need to permanently remove fresh produce from your diet. Fruits and vegetables remain important sources of fiber, vitamins, minerals, and other beneficial nutrients. The correct response is not to fear all produce. The correct response is to follow verified public health information and avoid products specifically identified in an outbreak or a recall. If a health agency announces that a particular product, brand, supplier, restaurant, lot number, or distribution area is involved, follow those instructions carefully. Do not taste recalled food to see whether it seems safe. A microscopic parasite will not make the food smell spoiled or taste unusual. Discard the affected product and clean any refrigerator shelf, container, cutting board, knife, countertop, or utensil that may have contacted it. Keep raw produce separate from raw meat, poultry, seafood, and eggs. Wash your hands before and after food preparation, and clean kitchen surfaces regularly. When eating at a restaurant, remember that you cannot rewash or cook a salad after it reaches your table. That is why official outbreak information is more useful than rumors on social media. A restaurant meal is not automatically dangerous, and most salads do not cause illness. But when a specific restaurant chain, supplier, product, or location is named by health authorities, check whether the date and location of your visit are included. Use information from recognized public health agencies rather than relying on forwarded messages, dramatic headlines, or unverified personal accounts. There is another issue that families often overlook. An intestinal illness does not occur separately from the rest of an older person's health. A person may already be taking a diuretic that increases urine production. Another may be taking medication that lowers blood pressure. Someone else may have reduced kidney function or difficulty regulating blood sugar. When that person begins losing fluid through diarrhea, the effect of existing medicines and medical conditions can change. This does not mean you should stop prescribed medication without advice. It means the healthcare professional needs to know what is happening so the situation can be evaluated safely. If you are caring for an older person with persistent watery diarrhea, begin by writing down a simple timeline. Record when the illness began, how many times the person is using the bathroom, whether the symptoms improved and returned, how much the person is drinking, and whether urine output has changed. Pay attention to balance and mental alertness. Ask whether the person becomes dizzy when standing. Notice whether walking has become slower or more uncertain. Make sure the path to the bathroom is clear. Remove loose rugs, electrical cords, and other obstacles. Keep the hallway and bathroom well lit, especially at night. Encourage the person to use a cane or walker if one is normally needed. Place a phone or call button within reach. These precautions may seem unrelated to diarrhea, but they can prevent one of the most serious consequences of dehydration in older adults: a fall. When checking on someone, do not simply ask, "Are you okay?" Many older adults will answer yes because they do not want to worry the family or feel that they are creating a burden. Ask specific questions instead. How many times have you had diarrhea today? When did you last urinate? Is your urine darker than usual? Do you feel dizzy when you stand? Can you keep water or other fluids down? Did you feel better and then become sick again? Have you eaten anything today? Specific questions give you specific information. If the person has confirmed or suspected Cyclospora, continue normal hand washing and bathroom hygiene. But remember that direct transmission from one person to another is considered unlikely because the parasite requires time outside the body before it becomes infectious. There is no need to stop offering comfort, physical contact, or normal family companionship. Someone who is weak, frightened, or exhausted needs calm support, not isolation. The most important message I want you to remember is this: Cyclospora is not a reason to panic every time you see a bowl of salad. It is a reason to take prolonged or recurring watery diarrhea seriously. The infection is generally acquired through contaminated food or water. Symptoms often begin several days after exposure, which makes the source difficult to identify. The illness may last for weeks and may improve before returning. Older adults face a greater risk because persistent fluid loss can affect blood pressure, kidney function, electrolyte balance, strength, and stability. Routine stool testing may not automatically include Cyclospora, so it is reasonable to ask whether the infection is being specifically considered. There is an established prescription treatment, but it must be selected and monitored by a healthcare professional who understands the patient's allergies, kidney function, medical conditions, and other medications. Commercial parasite cleanses have not been proven to replace medical care. Washing produce reduces risk but does not guarantee complete removal. Cooking provides greater protection when a product may be contaminated. Above all, pay attention to changes that persist. An older person may try to endure the illness quietly. They may not complain until they are already very weak. They may avoid drinking because they do not want another trip to the bathroom. They may insist that they are fine even while their urine becomes darker and their balance becomes less steady. Do not wait for the situation to become an emergency. Check in early. Ask direct questions. Monitor fluid intake and urine output. Contact a healthcare professional when symptoms continue, return, or produce signs of dehydration. A small parasite should not be allowed to turn a treatable intestinal infection into kidney injury, a serious fall, or a prolonged hospital stay. Recognizing the pattern early and responding calmly can make an enormous difference. Take care of yourself. Pay attention to the people you love, and never dismiss persistent weakness or diarrhea in an older adult as something they simply have to endure.